patient's in her mid-40s. She's had 3 kids. She's 5'9", 230 pounds, so it puts her at a BMI around 34. I think the take-home message for the viewer is that you can have 2 different patients with the same BMI, same height and weight, but the shape is very different. This patient's shape is very difficult, challenging. She's a V shape, which means that she holds all her fat distribution here, and then she has a very narrow hips with very little fat on the hips and the buttocks. So all her weight is right here. So different shapes, you get different results. We always do our best. We always get it right. We always get great transformations, but a lot of the final result depends on the starting shape. Anyone who's been following me has seen Morpheus. This is a different color, right? This is a baby blue handpiece, and it's a new handpiece. And the difference between this one and the black is that this goes deeper. I'm placing the handpiece on the area, hitting a pedal, and as soon as we do that, we deliver energy. So we do this multiple passes, multiple depths, meaning I'm gonna go 7 millimeters, 6 millimeters, 5 millimeters. And by doing this, we're gonna help tighten the skin and overall improve the texture and tone of the skin. 360 lipo fat transfer. Recall her BMI is 34. She also has a very challenging shape. It's a V shape, so I'm gonna get a marking pen. And V shapes are much wider here and then narrow. So something very specific to her, like I said, is the starting shape is hard. And in order to really correct the shape, I'm gonna have to add as much fat as I can to the thighs, the outer thighs, completely change the shape of the buttock, and then of course always take out all the fat from the waist, upper back and mid back. So this is the upper back, here's the middle of the back, that's the waist, this is the transition or the hip roll, this is where the contouring takes place. All right, very difficult shape, but we made a lot of progress. We cleaned out the waist. We added a lot of fat to the hip. This was 2,000 cc's per side, so high volume augmentation, high volume extraction or removal of fat. This is as small as I can get her waist, very thin, and she looks great. Huge improvement. Brought her in as much as I could. You can see a really nice improvement in the shape. This is just some loose skin. She may want to do a tummy tuck later, probably not. So 360 lipo, nice improvement in the thighs. Recall this patient's BMI was 34 and she had a V shape. These are the hardest shapes to work with, but regardless of the starting shape, we can always make dramatic improvement. So we went from a V to an hourglass, high volume case, injected 2 liters per buttock to create that hourglass effect. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.